But I've been doing Shang. I've been studying and practicing Shang for a while now. Well, my background, for maybe some people who don't know, is I did my Chinese master training in China. I did my college, training in China, and after that I taught at NCN for 5 years. And now in the last 2 years, I've just kind of done my own thing, and I have Shang and Jingguo training program that I kind of offer just worldwide. It takes about 2 years to finish. And personally, my own path with Shang has been, it's about, exclusive. It's what I've exclusively studied and practiced in the last 11 years. So I haven't touched any other formulas. I haven't worked with any other herbs that aren't in the Shang or Jingguo. I've only read books related to this. I've only studied things and cares to study and cares to remember and memorize things related to this. So I've been trying to dedicate my life to this, and also sharing this, because I feel it's one thing to see patients and touch lives that way. It's another thing to train other people and have them go out and touch lives, and I kind of feel that I can have even more value in my own life if I do it that way. So that's kind of what I've been trying to do. So I don't really know exactly how diverse the group is. Some of you I know, some of you I don't know, some familiar faces and so forth. I'd like just to kind of offer the opportunity to open up maybe with a question, with something, curiosity, something, and that'll get me started. I'm sure I have a lot to say. Yes?
About the history of the Shang.
Pardon?
I don't know that much about it.
Yes.
And so like the history of how it came about, and like the
Totally.
importance of it, and basically the body of knowledge in Chinese medicine.
Awesome question. The Shang, just briefly, the basic answer to that is that it's a book written in Han Dynasty by some guy named Zhangzhong Jing, and it's called, the Treatise on Cold Damage and Complex Diseases, the full title. And then ultimately the book was lost. Somebody else found it. He happened to be also a very smart person, and then he re-edited the work and split it in two. One being Shang, one being Jingguo. It wasn't called exactly that at the time, but in short, that's kind of the history of the book. So one being on Shang means all a book that discusses how to treat diseases that originally were triggered by one of the 6 qi, by an external pathogen or influence, whatever you want to call it. Right? And then the Jingguo was a book that treated everything but that. So basically everything coming from the inside or everything from a non-external, non-internal cause. So, you fall off your horse, you eat something bad, you get some other illness or emotional disorder, which obviously, you can get pretty emotional when it's bad weather, but that's not necessarily an illness, right? So that's the Jingguo. So there's 2 books, but they're actually 2 legs of the same person. So they should be studied together, they should be read together. When you master these 2 together, there's nothing that you can't treat. There's no illness that is outside the scope of internal, external, non-internal, non-external, right? There's nothing else out there, except surgery. It's not a book that talks about surgery. It does not treat with external medicine, right? Because in Zhou dynasty times, when they described the 4 classes of physicians, you had the internist, Ji, the doctor who treats illnesses from internal nature, let's put it that way. You have Yang, and Yang is the person who treats sores and abscesses and those kinds of things. And that's a surgical condition, right? That needs to be lanced, there's tools involved. There's herbs involved too, both internal and external, but it's a totally different class of illness. It's a different profession. Those are surgeons, right? And then you've got Shi, which are the dietitians. So people who only work with food stuff and tell you what to eat as far as your meals and stuff. And then you have the Shouyi, which are the veterinarians. Obviously, so there's no dietetics involved. There's no surgery involved. There's no veterinary medicine involved. Everything else is present. So that's kind of what the book is about. The tradition the book belongs to is the Shengnong tradition. Right? Herbal medicine always belongs to Shengnong tradition. Right? Huangdi Neijing, Nanjing, those kinds of books, Zhangzhong Jing, belong to the Huangdi tradition. They belong to the lineage of the Yellow Emperor, right? Which is the acupuncture lineage. And we call those the Yijing, right? Not Yijing as in the Book of Changes, Yijing, but the medical classics, or the medical canons school. And the medical canon school are the people who work out the theory. They've been the people who've been really putting their thinking caps on and figuring out theory. I'm talking, 3,000-4,000 years up till now, right? So because the Neijing was written 2,000 years ago, but is the product of whatever happened the 2,000 years prior to that, right? So that movement, intellectual movement, is called the movement, or the pai, the school of, or the lineage of the medical classics, or the medical canons. And it basically refers to the fact that it's based on written materials, it's based on codifying everything, standardizing everything, spelling it out for people, thinking about things, yin yang, 5 elements, those kind of things, conceptual, theoretical. Shahanlun is not part of that lineage. Shahan Zabing Lun, which is Shahan Jingwei combined, is maybe if not the first, in my book it's the first, but I think practically we should call it the third most prominent book of the Jingfang pattern. And the Jingfang is the canonical method or the canonical formulas school of thought or transmission or lineage. And those are the people that don't do theory, only do clinic, only practice. Of course, there's a lot of theory involved, but the lineage itself does not concern itself with theory. The lineage itself concerns itself with figuring out the flavors of plants, figuring out the activities of plants and minerals and animal products. You take them, what happens, how do you combine them, how do you boil them, what does it do for you, etc., etc. Of course, a lot of this stuff is informed by the yin-yang theories and the 5-element theories of Neijing and so forth and so forth. But actually, they're very distinct, separate schools of thought. Another very important aspect of the Jingfang Pai, the canonical school of thought, the canonical method or canonical formula school of thought, is that there's no acupuncture involved whatsoever. No meridians, no acupuncture points, no needling, no moxa, none of that. Zhangzhong references it a little bit, but it's not part of this lineage. So distinctly separate, right? So Zhangzhong is the third most important book. I think it's ultimately the most important because of what kind of book it is. It's a clinical manual. And a clinical manual is always more important than just some kind of pharmacopoeia. I mean, pharmacopoeia is important too, but what are you with the pharmacopoeia if you still don't know what to do and how to behave and how to act in clinic and how to use things, right? So Zhangzhong Jing has written a manual for the practice of medicine, herbal medicine in particular. Right? So the other two important books, of course, is the Shengnong Jing, which is the pharmacopoeia for single herbs, and then the Yi Yin Tang Ye Jing, or the decoction classic, which is basically the pharmacopoeia for formulas, or the standard formulary of the time. So Western Han Dynasty formulary and single herb compendia, those are the two standard works. And then Zhangzhong Jing takes that material and does something with it, practices it, right? Informed by yin-yang theory, 5-element theory, all those things that are present in the Neijing. 5-phase, 6-qi, like the climate model, all those things. Calendrial model, all those things inform him as he practices with those basic things as laid out in the Jingfang school. So he's basically the synthesis of Jingfang and I Ching